My first guest, by the way, is the president of the New Brunswick Medical Society, and Dr. Serge Melanson. Serge, thank you so much for joining us, doctor.
Thanks, Mike. Thanks for having me.
How are you doing?
Very well, thanks.
That's excellent. So, NB Medical Society, tell us all about it. What do you guys do?
Well, it's a pretty interesting group. Basically, it's a society that represents all the doctors in the province, so family doctors, specialist doctors, over 1,800 of us. It's a society that's been around for as long as the country's been, so it's about 150 years old, a little older than that. Mm-hmm. It's one of the oldest in the country, actually. And it's a group that has a bunch of goals, and some of those goals are to promote the health and well-being of our patients and our citizens in the province. Some of the other goals are more focused on the members, on the doctors themselves, in terms of supporting them in their careers. And then, of course, we've got a role with government and with other stakeholders in terms of engaging with them and having them understand the perspective of doctors when it comes to various healthcare issues.
Mm-hmm. So just a whole facet of a bunch of different things that there is to do here in the province.
Yeah, it's a pretty big basket, yeah.
Yeah, that's for sure. Now, for you as the president, we were talking about this just before we went to air, you're about a third of the way through your term already.
That's right,
You know, it's just a one-year term. So, what's it like to know that, really it's 12 months? I know you've been part of the board before that, but really it's 12 months in that position. So, do you feel kind of a time crunch, or do you feel comfortable? How's it been so far?
Well, you definitely want to give your best. You definitely want to put the time in, and you definitely want to contribute the most you can. But it is a pretty busy year, and I'm kind of doing this job on top of my full-time work as an ER doctor in town. And I've got a family with 4 young kids, and so I've got a bunch of balls up in the air. So for me, I'm actually enjoying it quite a bit, but actually quite glad it's only a single year, because I'm not sure I could make it past that.
I've got just the one, and the schedule is just like too much for me at that point too. You mentioned how old the New Brunswick Medical Society is. How much is that a source of pride for you to say, hey, I've been president for something that's been this old, this long?
Yeah, it's a massive history behind the organization. Some great things have happened, and a lot of the stuff that's transformed in this province has in large part been due to the work that doctors and other healthcare professionals have put together, and we are reaping the benefits of it today. But it doesn't mean we can stop on it and rest on our laurels, because there's a lot of challenges that our healthcare system and our patients are facing. So the Med Society is there as a leader, I guess, to basically help promote the health and well-being of the province.
And in speaking of that, we can go into not so much the mandate, but kind of some of the stuff that is being focused on this year in particular for the New Brunswick Medical Society. A big emphasis on preventative healthcare has been a big thing. Why is that so important?
Well, as a practicing emergency physician, I see a lot of chronic disease in my practice. And when you look at the stats that are put out there, the New Brunswick Health Council came out in 2017, and basically they said that there's about 60-some% of New Brunswickers that suffer from at least one chronic disease. That's something like diabetes, hypertension, heart disease, bowel disease. And a lot of these things are related to lifestyle choices, so whether it be smoking or whether it be poor physical activity or diet choices. And so when you look at that problem and you see the amount of stress that our healthcare system is under, trying to serve all of these folks that are coming in, you kind of have to understand that, unless we start kind of righting the ship here a little bit or changing the trajectory that we're on, we're going to be in big trouble in a decade or two from now. Not only in respects to, the life that these people have to lead and all the challenges they have with these chronic diseases, but those things are going to put a tremendous amount of pressure in the healthcare system. So, already today we're seeing, wait times for procedures and surgeries, and as an ER doctor, the wait times in the ER are just, just out of control. So basically, if we don't do something to get on top of the problem, it's only going to get worse.
Yeah, let's swing back and circle back to that 60% again. That's 3 in 5.
Yeah.
How daunting is that number to you? That seems like an incredible amount.
Yeah, it's a big issue, and when you look at other kind of health indicators as well, we're well above the average when it comes to chronic disease states. Our province, per capita, has some of the oldest populations in the country, actually, and we all know as we get older, our healthcare needs naturally increase, and that's kind of how it goes. So we've got a lot of challenges for a province this size. And when you consider that, over 40% of our provincial budget goes to healthcare, that there's not a lot of wiggle room for all the other budgets and all the other departments, and whether that be social development or health or education. So unless we do something to get on top of some of the issues that we've had, it's logical to think that the budget for healthcare will have to grow. And if it grows, it means everything else is going to have to shrink. So, collectively we need to decide, what do we need to do to get to a better place in a decade or two from now. And the Med Society is there to help guide that.
Yeah, certainly. And in mentioning this preventative healthcare, another way that we can kind of, eliminate a lot of the spending in that way, ideally, of course.
Yep.
If we can, use some preventative stuff and do some stuff even before you reach that
Yep.
that healthcare part to it. Do you have a couple of examples maybe of preventative healthcare for those who are watching and may not necessarily know exactly, what preventative healthcare might be?
Yeah, sure. So, one of the things that we're focusing on is the importance of healthy nutrition. So that is key and fundamental to one's health. And those that are in a position not to make the best choices, either because of, the pervasive marketing that's around us that kind of entice us to buy foods that are not the healthiest for us, or whether that be folks in a province that are suffering from issues around food security, which is a big issue in this province. I've been touring the province and meeting with different municipalities. I'm getting a strong sense that this is a big issue across the board, across the province. So when you look at those issues, it's important that the NBMS kind of engage those community stakeholders that can do something about it. So we've been kind of talking to local food banks, and we've been talking to different organizations like Nutrition First, which is an organization out of Fredericton that has healthy breakfast meals for kids when they come to school, and kind of eliminating the stigma around food security issues. And for in our own right, we're trying to put out small campaigns just to get people mindful of healthy food choices. And we've got one that's just finished today called What's in My Fridge NB, where we were just kind of challenging people to take a snap of their, a photo of what was in their fridge, and more importantly, share with us and other people basically, what do they do to stay healthy in terms of their food choices, and what do they do to keep their family healthy.
And speaking of that, we have a graphic up there now. What's in my fridge? That's not my fridge, but that's a good example of some of the healthy options that you can find in anyone's fridge. Really, that does look like anybody's fridge. And, it looks really well stocked, actually. Yeah,
it looks great. And some of the tips that some of these folks have shared with us are really kind of interesting, like taking time to prep things ahead of time and have it stored up in the fridge so that you're not constantly looking for that last-minute snack, or having healthy snacks already set up and ready to go inside the fridge, so that when you pop that fridge open, you don't have to think, oh, I got to put something together. It's right there, you grab it and you go, and it's a healthy choice. So little tips like that we are kind of promoting and sharing with people, and get them thinking a little harder about health and their food choices. I know we mentioned about that contest specifically before we went to air, about how there were a lot of people sharing their own tips. Yeah.
And I know you just alluded to that. In the saying, it takes a village. In a lot of ways, do you find that to be a little bit more of part of the campaign as well? To say we're not just saying this, but people in the community are saying it as well and trying to help out.
100%, 100%. We talked earlier about the food banks and stuff, and we've been touring the province and going to First Nations communities and going to other communities with really progressive thinking on food banks, and getting past what food banks were traditionally what they were, and breaking down stigma around people attending those food banks, and offering educational kitchens to help them prep food and understand how to stretch that food out for longer periods of time. And you look at the school system basically, and I think there as well we need to kind of get back to some fundamentals there. We need to get back to home economics. We need to get back to teaching children the important value of food, nutrition, and how to prep this stuff. Because we've kind of gotten away from those things, and generationally we've been raised where oftentimes both of our folks are outside working, and so we've gotten to a point where we haven't seen that modeled in our home either. So we need to kind of go back to the drawing board and start kind of re-educating the next generation, because again, if we're going to continue the same trajectory that we're on now, it's not going to end well, I'm afraid.
No, it's unfortunately does sound a little bit like some doom and gloom, but with that preventative stuff, hopefully we can get there. We got about a minute and a half.
Yes.
Unfortunately, we'd love to talk a whole lot more, but unfortunately that's all we got. I know that we did want to talk about the flu shot, because the flu this year is a little bit worse going around. Let's discuss the importance of it. We got about a minute.
It's very important. It's the easiest, simplest, and most effective way to prevent the flu, and it may not prevent it 100% of the time, but it certainly may lessen the intensity of it, and judging from the one I'm seeing this year in my patients, it's a rough one, and it's really knocking people down when they get it. And it's still not too late. It takes a couple of weeks to take effect. I anticipate this flu will be here for another several weeks anyways. So for those of your viewers who haven't been vaccinated yet, get out there, get the shot.
Yeah, you can get it now, and you can get it wherever you usually get your flu shot. Lots of places do have it available. They'll say if they do.
That's right.
So certainly that's the way to go for it. With that, do you have any other quick tips? We got about 30 seconds. Do you have anything else you may want to let people know?
Sure, thanks, Mike. Just basically anyone interested in finding out what the NBMS does, what I'm up to, and what our groups are doing, basically, visit us on NB Docs, either on Twitter or on Facebook, or check out our webpage. We've got lots of interesting information there. We're always very interested in hearing what people have to say about healthcare issues in the province, and we're all in it together.
Yeah, get in contact. The website's right down there, nbms.nb.ca.
Yeah.
So be sure to go and check it out and take a look and see what's there and get in contact. So Dr. Serge Melanson, thank you so much for joining us.
Thanks, Mike. Thanks for having me.